We'll stand and have the Pledge of Allegiance in a moment of silence.
Pledge allegiance to the flag of the United States of America and to the republic for which stands one nation under God, indivisible, with liberty and justice for all.
And roll call.
Show one supervisor absent. Supervisor Hunt.
Okay. Approval of the agenda. This time I'll seek a motion to approve the agenda.
So move.
Is there a second?
Second.
Toss. Any discussion? Let's see, we only have one remote, so we still have to roll.
I believe so, yes.
Okay, we will be doing the roll call vote.
Supervisor Michelson.
Aye.
Supervisor Shipman.
Aye.
Supervisor Kervina.
Aye.
Supervisor Eisenhuth.
Aye.
Supervisor Ives.
Aye.
Supervisor Hull.
Aye.
Supervisor McGill.
Aye.
Supervisor Steele.
Aye.
Supervisor Sikorsky.
Aye.
Supervisor Schmidt.
Aye.
Supervisor McMiniman.
Aye.
Supervisor Thornton.
Aye.
Supervisor Hauser.
Aye.
Mr. Chair.
Aye.
14 ayes.
14 aye, motion approved. This time we will call on members of the public wishing to be heard, and you'll have 5 minutes. So if we have any members of the public wishing to be heard, could you identify yourself at this time? Hearing none, we will move to number 6, consent agenda. And we will vote as one as all unless someone wants to pull one of the items out. So at this time, I will seek a motion to approve the consent agenda.
Motion approved.
Is there a second?
I'll second it.
Any further discussion? Hearing none, then we will call the roll. Vote.
Supervisor Sikorsky.
Aye.
Supervisor Schmidt.
Aye.
Supervisor McMiniman.
Aye.
Supervisor Thornton.
Aye.
Supervisor Hauser.
Aye.
Supervisor Michelson.
Aye.
Supervisor Shipman.
Aye.
Supervisor Kervina.
Aye.
Supervisor Eisenhuth.
Aye.
Supervisor Ives.
Aye.
Supervisor McGill.
Aye.
Supervisor Steele.
Aye.
Mr. Chair.
Aye.
14 ayes.
Okay. 14 ayes, passes. Reports, we'll call on the administrator.
Did you get missed?
You got left out.
Oh,
That's okay.
What happened?
We missed Chuck on the roll call.
sorry, Chuck.
Oh, okay.
I don't know why I skipped.
Agreed with the conclusion.
We're getting used to it. Being back to the
Welcome all back.
First of all, I'd just like to say it's great to see you guys. been a long time. We had department head meeting today, and it was good to see a bunch of people who could hardly calm down before the meeting. So it's good to be back together. So the redistricting process, obviously we sent information out about this. And then originally we received information that we weren't going to get the actual data from the federal government till July 31st, or March 31st. And then that moved to July 31st. And then the latest has been September 30th. Obviously, it was a September 30th date. There's no way to meet the statutory requirements to get the information done in time. So WCA is working with the legislature to do some kind of legislative change. We know there has to be one, but what that looks like, we're not exactly sure. WCA worked through like a timetable that they're going to recommend in order to get through the process. And essentially at the end of the timetable would be the 2024 or 2020, 2024 spring election is when everything would be done. We don't know what the legislature is going to do, but we definitely know they have to do something. So I know WCA obviously is a high priority. I know it's a priority of the board here too. So we'll work through it, and when we get the information, we'll send it out to you guys as soon as we get it. That's all I have, unless there's questions.
Any questions? Okay, and then I'll call on you to also do the general report for the April meeting.
EDA, we got EDA first.
Oh, you didn't do the EDA? Okay.
No, sorry.
Did on the EDA.
Yep. So wanted to give an update. Again, we sent this out, but we did not receive the funding for the EDA grant that we're working with North Central or with the regional planning, the city of Eau Claire, and then CVIC, obviously. Very disappointing. We didn't really get a great explanation. We put the bullet points in that they sent to us. But Craig Johnson from regional planning is trying to reach out to EDA to find out if we could have done something different or better, or if anything comes along next time, we'll look to do the same thing. But that's the information we have right now, is they just didn't approve them. They said that obviously there was a lot of applications and we didn't get it. So just wanted to make sure the board was aware of that. All I have, unless there's questions on that.
All right. Then the April board meeting?
Yeah, so it's kind of a weird thing in the state statute. We're required every April to meet on the third Tuesday of the month. They call it the organization meeting. Obviously, it makes sense when we had the election, but on the off years, it really doesn't, but that's state statute. So we just wanted to put this in there as a reminder because it's a little different than what we normally meet on the second Tuesday.
Okay. Questions on general reports? Then we will move to number 8, business items. Resolution 14.21.
Resolution 14-21, resolution to create 2 full-time account assistant positions in the Department of Human Services in 2021 to support the Recovery and Wellness Consortium. Now therefore be it resolved that effective upon passage of this resolution, 2 account assistant DHS positions are hereby created in the fiscal division of the Department of Human Services to support the growth in the CCS program, and be it further resolved that these positions will provide direct support to CCS social workers and will therefore be funded by using the Medicaid revenue generated by those positions, as well as the CCS reconciliation process. And be it further resolved that should the state and federal funding necessary to fund these positions no longer be available or be reduced significantly, these positions may be eliminated, forwarded to the county board by the executive committee.
Okay. I see Tim Isker is here.
Need a motion.
Oh,
Motion to
yeah, I'm just looking at if we should hear from them and do the motion, or we can ask for a motion to approve, I guess, at this time.
Motion to approve.
Is there a second?
Second.
Okay, any further discussion? That's when Tim would come in.
Good evening, everybody. So what we're here about is the Comprehensive Community Services Program. And for those who don't know, or a little refresher for those that do know, Comprehensive Community Services, Chippewa County is the lead county for a 9-county consortium. CCS is a program that we use to treat children and adults with mental health and substance use disorders. So what's really nice about this program is this is a fully funded Medicaid program, which means that everything that goes into it is funded by Medicaid. We even have pieces of my time that go into the program, DOA, Randy's time, and so forth. All that time goes into it. So it is one of those fully funded programs. It's also a great program in that we're working with a population that we haven't really worked with in the past, just because there hasn't been the opportunity to do that due to funding. And it's individuals that we can work with and we can do some services with before they get to those deep end services, before they're ending up in Winnebago at $1,350 a day, or at Trempealeau at times, which is a longer term facility, which will run us $10,000 a month for those individuals that are there. And that's what we ended up with a little issue last year. But be going into that later this year. We have a PowerPoint that we're putting together to give folks a little explanation of all those costs that go into that. So that it's a great program. And how this came to light is I was meeting with Randy and Lori, and we started talking about how we were behind on billing. Lori brought to my attention. Typically, we're running about 2 months behind. We were behind a couple more months. And the impact on that is people are getting paid, but what happens is that we start using up our working capital, and we have to go into the county's, I'm not sure if it's a fund balance, what we would call it, the county's fund balance, working capital, which gets reimbursed. But for a period of time, we're using that as working capital. So going into the resolution, why this is an issue is at the end of December of last year, we had 616 program consumers. We have 5.55 full-time employees. Historically, each FTE supported an average of 88 consumers. However, at this point, there are 111 consumers per FTE, which is why we started getting the backlog. And Paul Brenner, our fiscal manager, is here to give you a little in the weeds, kind of why this program is a little more complex than the other typical billing that we do.
Yeah, first I'll just to the extent Jim mentioned we're behind, I want to just let you know what that means. In the normal course of events, there's first of all, each county in the 9-county thing, we all pay for our own expenses. And to the extent we use contracted providers to provide services to the consumers, they're paid by Chippewa as the lead agency. So that's how that works. So each county is paying for their own people to do their work, obviously. Right now, and I'll just use January as an example. January, the month ends. All these outside providers have 2 weeks to get their bills to us. So we ask them to have them here in 15 days. So in the middle of February is when we would pay those outside providers. And then we have 30 days to pay them. So we would pay them, we'd start paying January business at the end of March and on into April. So there's that 2-month lag built in. Where we are today, we need to pay, we're partway through September. We have the last quarter of last year, so we're 3 to 3.5 months behind. Sounds like 6 months when you look back, but it's really 3 months because the most current months aren't due yet. So I just wanted to clarify that. To the extent we pay these providers, if the fiscal team here, if we're all right on time, we do have money on deposit from the partner counties to pay for that float that Tim mentioned. But when we fall behind, we're short. So that's when it comes out of our till, and we don't want that. We can't have that. So we need to be current, and that's what we want to do. And that's what this is about. The reason we talk about the consumers, this program is funded very differently. Human Services generally is funded by grants and county tax levy. And how the grants work, we have a couple big grants. The Department of Children and Family gives us about $1.3 million. Department of Human Services gives us a couple $1 million. And what we do is every month we have our accounting records set up to key to these grants. And on a macro basis, we submit a cost report each month and they reimburse us. There's other reporting we do. There's a report when it's all over. Where did you spend the money? It's not really tied to the number of people we serve directly. If we serve twice as many people, there wouldn't be twice as much fiscal work to do. There'd be just a little bit more. What's different about CCS is it follows what I'd call a medical model. It's like running a clinic. So each consumer, when they get a service, we get billed individually for that from the providers. We get a medical note for that. We have an electronic health record. We need to file those notes. We need to bill Medicaid individually for each of those services. And it's very labor intensive. It's tied, the more people you have, the more of all those things you have, and the more staff we need. As this has grown over the years, For the first few years, we started in 2015. We had 3.5 people dedicated to this for really 15, 16, 17, 18. In 2019, we added 1 staff member as the number of consumers have grown. Looking back, we should have added 1 probably in 2020 and 1 more in 2021. We didn't do that. That's behind now. And that's why we're asking for 2 positions now. And it's based on that growth.
And as we recall too, we ended up being cited by the state a year ago for a waiting list. CCS is one of the programs where you cannot have a waiting list. The consortium has done a really nice job of eliminating that wait list. We've got a few here, there's a few in Pierce County, but for the most part, that's why we've had this huge ebb of consumers that have come through. Are we going to reach a point where the attrition is going to meet the number of new consumers coming on? Maybe. It's not growing as quickly as it was, but we're still seeing some growth, which is a good thing. Like I said, it's good to deal with folks up front instead of letting them get so ill or let their addiction get the best of them where we're in some really deep end services. So, have we reached the peak yet? No.
Okay. Any questions from the board? Okay, thank you.
Thank you.
At this time, I'll have the clerk call the roll call vote.
Supervisor Thornton?
Yes.
Supervisor Hauser?
Yes.
Supervisor Michelson?
Aye.
Supervisor Shipman?
Abstain.
Supervisor Kervina?
Aye.
Supervisor Eisenhuth?
Aye.
Supervisor Ives?
Aye.
Supervisor Hull?
Aye.
Supervisor McGill?
Aye.
Supervisor Steele?
Aye.
Supervisor Sikorsky?
Aye.
Supervisor Schmidt?
Aye.
Supervisor McMiniman?
Aye.
Mr. Chair?
Aye.
13 aye, 1 abstain.
Okay. Resolution passes. Move on to business item number 2, ordinance 01-21, ordinance to amend Article 2. And I'll have the clerk. You want to read that ordinance?
Just read. This is a first reading.
Yep.
Brian?
Brian? Yep. Yeah, no vote here, so go ahead.
Just want me to give a recap of what it is. Basically, we had a resident come to us in the city of Stanley that was concerned about the speed. It's a increased amount of pedestrians using this stretch of X to get to the new Quick Trip. We did a speed study as we were requested by the Traffic Safety Committee to do, and the highway engineering analysis came back that it should be lowered to 25 in that area. We looked at maybe lowering it out further to the east even, towards the high school. And that actually becomes a 55 mile an hour stretch out there. And to lower that, you'd need DOT approval to lower it by more than 10 miles an hour, and DOT didn't grant that. We were going to extend the 35 mile an hour all the way out to the county line. So that wasn't approved by the DOT, but we did go through the analysis, and the Traffic Safety Committee and Highway Committee both endorsed lowering the speed limit. Matches all the adjacent neighborhood streets in that area too.
Okay. This is the first reading, so we won't be voting on it, but if you have questions, you can certainly entertain those questions at this time.
I had a question, Brian. You normally go from 20 or 35 down to 25, or you don't suggest 30, or?
Well, actually, statute only allows you to change it by 10 yourself without getting DOT approval. So we did an engineering study which looked at the existing speed that vehicles are traveling out there. And we know that if we lower it to a certain point, people won't obey that. And you'll have a lot of speed differential or possibility of collisions from speed differentials. And so everyone's different. We look at all the existing conditions out there and the existing traveling speed, what people will actually obey.
Wasn't that the whole rest of the city is 25 miles an hour also?
Yeah, pretty much all the residential streets in Stanley are 25. There's a couple 35s, but everything in this area is 25.
Sorry.
The city of Stanley, I've been contacted by a couple of council members. They'd like to see the speed limit reduced out to where County Highway double N goes south. Then there's a little, they call it Short Street, goes over the railroad tracks
Yep.
because of the school traffic, the school bus traffic. And I sent them to your office. So, but they'd like to see, were they involved in this? Was the city council involved in this?
No, I don't believe so. This came right through the traffic safety.
Because they didn't, the couple of guys that called me about lowering the speed limit, where that 55 is, they'd like to see that 55 out on the other side of double N if you can get there. I directed them to you guys.
Yep. We did look at that, and if you go any further to the right from that map, it gets pretty rural out there. There's not too many houses or anything, and DOT looked at that, and they just said that the traffic won't obey that. In those conditions, it won't obey a 35-mile-an-hour speed limit. You'll be having too many differential speeds out there.
Any other questions? Thank you, Brian. All righty. Agenda items for future consideration. Hearing none, we will go on to number 10. Do I have a motion to adjourn the meeting?
So moved.
Second.
Motion's been made and seconded to adjourn. We will have the clerk call the roll.
Supervisor Shipman,
Aye.
Supervisor Curvino,
Aye.
Supervisor Eisenhuth, Supervisor Ives,
has left the meeting.
Aye.
Supervisor Hull,
Aye.
Supervisor McGill,
Aye.
Supervisor Steele,
Aye.
Supervisor Sikorsky,
Aye.
Supervisor Schmidt,
Aye.
Supervisor McMiniman,
Sterling Kaiser
Supervisor Thornton,
has left the meeting.
Supervisor Hauser,
Aye.
Supervisor Michelson,
Aye.
Mr. Chair. 14 aye.
14. Thank you for all coming. It's people back.
Just practice for the future.
Oh, that's